Hi, I'm Dr. Bruce Marshall of the Marshall Clinic in Vancouver. This week's topic is why implants? Often, people, when they lose a tooth, have no idea that you lose bone when you lose a tooth. So, surrounding the tooth, there's bone that's called the alveolar bone. And once you remove a tooth, very quickly in the first 6 months, and then more slowly after that, the bone that's responsible for holding the root of the tooth in place disappears. So obviously, and if you look at somebody who's had a tooth that's been missing for quite some time, you'll see a significant bone defect there. So what we do when people are losing teeth, we often try to manage the negative effects of this early on. And we'll talk about that later in a topic of socket preservation. But to go on with the concept of why implants, so one of the big things that happens when you lose a tooth is you lose bone. Most people have no idea that this happens, and most people have no idea that when you put an implant in, it can help you preserve that bone. And so through normal loading of the bone, you can preserve the bone, just kind of like the astronauts up in space who have to do those special exercises to maintain the density in their bone. If you maintain forces on the bone, you maintain the bone in place. So that's probably the most important reason. The second reason is you can eliminate the need to tie teeth together. So often, as we talked about in one of our other topics, which was the options for replacing missing teeth, one of the next most favorite option is a fixed bridge. And a fixed bridge is where you cut down the teeth on either side, you grind on them to make room for a crown on either tooth, and then you secure the tooth that you're going to replace in the middle of those two things. So you have to restore those teeth, and if those teeth are teeth that are unrestored, you're giving up a lot of healthy tooth structure there that you can maintain if you do an implant. The other negative of tying the teeth together is it makes it more difficult for oral hygiene. So you have to get a little threader and thread it underneath the bridge in order to properly maintain that. And the predictability of fixed bridges is at least 10% less effective over 10 to 20 years than an implant because of decay, loss of retention, or the need for doing root canals. So the third, or the final reason why we think that implants are so great is that they can't decay. So the main reasons that people lose teeth and the main reasons that people might have a problem with a bridge that you could do would be tooth decay. And so if you can prevent that, you're reducing your risk for tooth loss significantly. So those are the main reasons. That's all for this week. So thanks for watching. If for more, subscribe, and next time we'll talk about the process of replacing a missing tooth with an implant. Thanks, Bob.